Back in the late 90s to early 2000s, I was working for a dental distribution company and selling dental practice management software. There was no cloud-based systems back then. And we were simply talking about things like digital cameras, digital x-rays, things along those lines.
The thing that's interesting about this age, I think it was like the golden age of dentistry as far as just like things were easier, life was a little bit less stressful, but it probably wasn't the best time for patients, the 2005 to 2015 era first. So this we kind of labeled the era of consolidation in tech. Welcome back to another episode of Dental Marketing Theory. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But you can't grow if you're following the same playbook from 30 years ago. And today I have Perrin with me, and he's going to be walking us through these three different eras. So I'm excited to get to that end era because I really want your thoughts on the market as of today. But before we jump into that, let's talk about from 1995 to 2005. This is kind of the foundation of what we're building on today. And you and I talked before I hit record. Everybody was fee for service. Nobody did advertising. If you did do advertising, you were like a bad guy that the dental board in your local community would try to shut down. Everything is almost 100% mom and pop, like really close to no DSOs, no groups, no anything like that. And you called it pretty much a cottage industry. I mean, it was, if I was going to pick an era, this would probably be the era I'd want to work in. But we also have a lot of people who are still practicing that way because they started then. What are your thoughts about that era, and what can we learn from it?
Yeah, Gary, great to be with you today. This is going to be a fun conversation. So actually, back in the late 90s to early 2000s, I was working for a dental distribution company and selling dental practice management software. So I've got a pretty good look at where this conversation starts, and it was integrated hardware and software networks. There was no cloud-based systems back then. And we were simply talking about things like digital cameras, digital x-rays, things along those lines. And then you started getting in, and it was all based off of, predominantly Windows networks, something called this was 1997, I think, is when I started in that division and worked until about early 2000s. So, you had all of a sudden this concept, if you will, of the paperless office. And that helped to take some cost out of normal operations, I would say, and improve efficiencies around scheduling, collections, things like that. When patients could all of a sudden see the condition of their tooth on the screen, either through a digital x-ray or through a fiber optic camera image, now seeing is believing, right? So we get into the advent of integrated network systems from a patient education standpoint that increases case acceptance and ultimately starts to lift the revenue envelope on a lot of these individual practices. Back in the late 90s, early 2000s, almost everything was solo practice. Maybe if you were an orthodontist or pedo-ortho group of 2 locations for convenience to patients, that would be considered a multi-site healthcare practice. Not what we think about today whatsoever, but this is really pre-consolidation. And I think what you saw in those ages and stages of late 90s to early 2000s was the change of what I would call like your father's dental practice, right? When you mentioned like nobody advertised, well, if they did, they took out an ad in the yellow pages. Most of your audience, Gary, doesn't know what the yellow pages were, all right? They weren't a division of Google, let's put it that way. I think the great thing about this first stage that we're talking about here is that at a clinic level, practice level, operations level, we have more digital applications being centered around the convenience of the patient and the opportunity to present treatment in a more credible way that they can see and embrace, not just from a feel standpoint. Well, it's not hurting me. I'll just wait, right? It started to move a lot of that decision making back to the urgency, or it created urgency behind decision making for the patient, and that was the first real accelerant to generating more revenue and ultimately more profitability in a practice level scenario.
Yeah, the thing that's interesting about this age, I think it was like the golden age of dentistry as far as just like things were easier, life was a little bit less stressful, but it probably wasn't the best time for patients. And the reason I say that is I remember back then, right? I was born in 82. So in from 1995 to 2005, everything was controlled by the local dental boards in each city, and they kind of controlled how many dentists came in. And the reason they didn't need to advertise was because they controlled the supply. And so this would create huge lines for just to get in to get your teeth cleaned or see a dentist. Like things were very not friendly to the patient. It wasn't consumer based. Everything limited hours, limited access, limited pretty much everything that you can think of, right? And so while it was great for the dentist, it wasn't so great for the patient at that time, or at least from a consumer standpoint. Now, what I also find interesting is I still bump into quite a few people who practice from that era, and they give advice, a lot of advice, because they crushed it, right? They were like, dude, I never had to take out, paid off my loan in a year. And, and I think about them, their college bill was maybe 50,000 for 4 years of dental college. Their bill to buy the practice was maybe really low. Right. And so they were able to get out of debt really quickly, and interest rates were friendly back then. And so I see that it was like, maybe it was good. The advice that they're giving was maybe good for back then, but it's a lot different now. Do you have any thoughts on that and that kind of era and how people might perceive it?
Yeah, I mean, so uh, I I'm an optimist at heart, so maybe I want to take the tack that the best days are ahead of us for you, me, for dentistry, for anything else. Things get better. We would never go back, so to speak. But I think from a small business ownership standpoint, and a general competitive strategy standpoint, there were a lot less competitive pressures, and switching costs were a lot higher because like you say, a lot of practices weren't taking new patients at the time. And if you were in with a good dentist, you probably trusted him or her to a high degree. And were very loyal to that type of a practice. So these practices were stable. They didn't suffer a lot of winds of change as it relates to patient flows and things like that. I think those that started practices in the 90s or even early 2000s. I'm a little bit older than you, Gary. I was born in 1970, so I'm 54 now. But if they're dentists that are about my age or maybe a little bit older, they have practiced through um, that period of diminished competition into a period of hyper competition. And a lot of that is driven by consolidation. It's driven by a lot of market pressures, which we can get into, that create marginal.
Yeah, that's phase 3. So before we jump to that, which I love it because I love where your brain's going, but let's talk about the 2005 to 2015 era first. So this we kind of labeled the era of consolidation and tech era, the DSO consolidating software and hardware. And you saw this firsthand. What are your thoughts about this era and what made it special and how it impacted where we're at today?
Yeah. So, I think it's interesting because we tend to look at healthcare services businesses, regardless of, what aspect of the profession they're in. But we tend to look at them as healthcare professions first and foremost. And we don't necessarily think about them as being a small business, but they are. And by that, I mean that every business, no matter what it is, could find itself in a potential consolidating type market. And the reason for that is that usually the bigger a business gets, is the more disposable income, for lack of a better term, it has sloshing around in that business. And the more that income can be reinvested in the business for growth purposes and hopefully profitability purposes. So when we start thinking about consolidation, and I mentioned the digital technology, whether it's CAD CAM based systems or hardware and software networks, are now cloud based systems and practice management and all that other kind of stuff, even way pre AI. But first off, that digital technology was brought to bear at a patient level to increase case acceptance. But now we're starting to see how a consolidating industry uses technology and buying power to create size and might that squeezes incremental costs out of businesses. We see this in banking. We see it in hardware like Lowe's and Home Depot. We see it in dental distribution.
Give me like an example, because I hear you loud and clear, but a lot of times I think the business words, just like dental words, right? When dentists use big words on us, like, give me an example of like somebody who versus a one practice versus 10 practices. What's the advantage that a 10 practice that can squeeze without changing anything?
Yeah, so I think it's probably got two or three different components to it. One, for let's not put revenue off to the side, because if we have 10 locations, the likelihood is we can accommodate a lot more providers and even share them in between locations. We can reinvest marketing dollars, which create more new patients. We can expand into days and hours, which creates more convenience and opportunity for patients. So there is a revenue generation component to a larger multi-location group. Then the second piece is we have greater buying power. So we can buy our cotton rolls for less, our lab costs are less, our professional services are less. We can spread our marketing investment over the same brand in 10 locations versus just one, and on and on and on. The third piece is when you really get these things dialed in, I'm hesitant to put it this way, but you can start to reduce headcount. And wages are the biggest expense of your business, my business, and a group healthcare practice, labor, exactly. So do we have to have two people answering the phones at every single location, or can we create a call center where we only have, in a 10 location group, maybe we have 12 people answering the phones instead of 20? And now we can start to really take dollars out of the structure, the operating structure of the business itself.
Yeah, and I know you're like hesitant because I know how people hear that, like, oh, you want me to lay off my team? But maybe a better way to phrase that for somebody who feels that way is like, look, right now you have a bunch of people who are doing a bunch of different jobs. So like, they're not just the front desk, they're billing, they're this, they're that. As you grow, you can start to specialize those people where no, your only job is billing. That's it. And your only job is answering the phone. And so you don't need as many people as you grow, right? So I love that breakdown. And then the other thing I think too, and I might be wrong on this because I've heard conflicting stories. I'm pretty sure the bigger you get, the more you can negotiate with the insurance companies too, right?
I would, yes, I would bet a lot of money that a Heartland Dental reimbursement rate for a crown is a lot greater than a dentist on the corner would be for the same insurance plan. Yeah.
So you can throw your weight around for everything, and again, not reduce any of your care or what you're providing to the patient or to your team, which is awesome. And then you win because now you're making 3% more, which might not sound like a big number, but when you start to add it up over multiple practices, it becomes a huge number and a lot of money. You're talking about a lot of money there. So then now we move into the era that we're at right now, and we call this the COVID innovation and then hyper competition. And this is the 2015 to 2025 where we're at today. And the thing I want to call out here is that what got us to this point and made us successful will not work anymore. And I see this so clearly in marketing where people are like, well, I have this conversation all the time. 10 years ago, I used to spend $2,000 and I got 50 new patients. Now I'm spending $2,000 and I'm only getting 20 new patients. What's going on? And it's like, well, you got to understand, Heartland's launching locations, de novos, and they're spending $25,000, $30,000 a month on digital advertising right down the street from you. Like, that's what you're competing against. 10 years ago, you weren't competing against that. And so there's more dentists. They're more innovative. People are spending more money on marketing. They're spending more money on technology. And it's just harder, right? And so like COVID for everybody sped up that technology, that adoption. It did for my company. I know it did for you. So, and this is kind of where you thrive, Perrin, because your company's set up to help dentists in this new era that we're at. So where are we at? And then I would like you to tell how you help people to kind of get to where we're going too.
Yeah. So, I think when we think about like the era that we're living through right now, and COVID was, for better or for worse, probably an accelerant to a lot of the consolidation we've seen. And we can talk maybe on a different podcast about valuation metrics and, is it good? Is it bad? All that kind of stuff. Like here's the way I look at today. And that is that right now we have still the better part of 50% of the population that doesn't see a dentist on a regular basis. All right. And when we think about the younger millennials and Gen Z, the ADA's done a lot of studies on this that indicates that they make healthcare service buying decisions the same way they buy anything else, which is transparency and convenience. All right. So if they are working full time and it's more difficult to take time off to see the dentist, they're looking for the opportunity to see a dentist after hours or on weekends, not Monday through Thursday, 8 to 5 necessarily. So if you're running an old school type of a practice and it's 100% fee for service and you don't need new patients, by all means, like milk it as long as you can. I love it. That is a unicorn. If we are a general dentist and we're having to compete with other general dentistry practices, convenience is an aspect of that, and price transparency is too. The other thing is that Gary, you've got to be able to create a different experience from a patient standpoint when somebody walks through the threshold of your door. And all of your team, everything they do from the moment they pick up the phone to the moment they greet them, to the moment they take them back into the treatment room, to the moment they dismiss them or have to follow up about whatever it may be, every member of your team, including the dentist himself or herself, either adds to or detracts from that patient experience. And I think that's a squishy point that nobody really seems to think twice about. But darn if it's not true, because the people who come and don't return are never going to tell you that's the reason. But those who have a good experience that feel like they're going to see their friends almost will return and will stay in your practice.
I had one of my kids, he's an adult, and so a newly minted adult, and so he was like, I want aligners, and I'm like, go buy aligners then, right? And I'm in dental, so I know enough to be dangerous. So I'm like, ask these questions, and So he shows up to the dental appointment. He totally able to afford aligners. And he walks in and he's like, hey, I want a liner, And he's an ignorant patient, just like most young people, right? And even a lot of adults, we don't understand dentistry. And the person presenting the fee start telling him how he's not going to be able to afford these aligners. And he left. And he went down the street to another dental office and they didn't treat him that way. And they set him up with financing. And it was just like, that's the patient journey, right? Like I've seen dental offices literally firsthand with my family, but I see it all the time, where the team is scaring away patients and they're just like, you're not able to afford this. You don't want this, And so it's just so funny how that's probably the biggest factor to success, but the least talked about and the least people focus on. And the other thing I want to call out that you said there that really struck me is that you said that the practices from 1995 to 2005, those were the ones that were everybody, the majority are now the unicorns. And the interesting thing is that back then there was no price transparency in anything. Like you had no idea how much stuff cost anywhere because the internet wasn't really up and working in our favor yet. But now, and there was also no, like if I wanted to order something, I had to go to the store and then I had to like take all day to look in the store. If I wanted to price shop that, I had to go to another store with the information that I got from the first store and compare it. And then if I wanted it delivered or something like that, like, man, that took forever and was very costly. But now today I can price compare anything like in the whole world. Anywhere yesterday I was looking at cruises at this part of the world versus that part of the world, right? And like, seasonality, okay, I'm going to compare that, and I can price shop anything and get the best deal possible with the most value, and I have complete transparency into the pricing and those kind of things. So it's almost like the world flipped, right? It's like what used to be normal is now a unicorn, and what the patients used not to have access to, now they have Amazon, they have the internet, and they have all these tools to them. And so bringing it back to like culture and how your patient journey works, that really becomes the unique identifier to your practice.
Yeah, and it should. Like I say, it's part of. I hate to use the term value proposition, but it makes a difference in the way that a patient thinks about your practice or doesn't think about your practice. And I think it's a piece that's not really top of mind for far too many people, and it absolutely should be, because if not, none of us want to be competing in a commodity world. You don't, I don't, a dentist doesn't, and one way we can get off of the commodity train, if you will, is to focus a little bit more of our efforts on the way people perceive their experience in our environment.
Yeah. Now, how do you help practices go into this next phase of where they're at today, and they're like, okay, I get it. It's way more way more competition, way more. It's way harder. Everything's harder. Everything's more complex. Everything has more technology to it, but the patients are more complex. They have options. All this stuff with the patient journey and the culture and how we treat people and how they feel and all that kind of good stuff. How do you help offices today compete in that realm and move to that next move to wherever they want to go, right? Wherever you're taking people, whether that's adding more providers, adding more locations, or just being more profitable. Like, how do you help them with that?
Yeah, so you know me well enough over the last decade or so to know that I've worked with group practices in a consulting and a transactional advisory way, and the two prior companies were Tusk Partners and Polaris Healthcare Partners. Great experiences, great clients, great journeys. I mean, just dynamic to say the least, and really had some tremendous outcomes. That being said, it's not a journey for everybody. Just because seemingly your best friend is doing it doesn't mean that you should build a group practice too. And I think that for a lot of those consulting and transactional companies, you've got to be a certain, I don't know, size in terms of number of locations, revenue, profitability, and things like that to really merit being able to apply the consulting services or associate equity services and, have a need for it, but also be able to afford it. And then I think there are a lot of people who have, at the other end, are probably a solo practice, maybe two, that are clinicians who own practices. And they have, to a degree, some level of practice mastery. And they're sitting there asking themselves, okay, what's next? If we did learn one thing coming out of COVID, it was that there were a lot of people that arguably sold multi-location groups and practices prematurely. They sold them for an inflated number. They rolled a lot of equity. They might have chosen a bad partner. It didn't materialize. The outcome hasn't been that great for it. So there are a lot of people who have very successful practices that cash flow wonderfully, provide great clinical care for patients, are very stable. They're not turning over their staff and things like that. And the owner is sitting there asking himself or herself, okay, what's next? Like, should I build a group practice, or I've got a pretty good gig right now. Can I maintain it for the next 30 years? I would tell you, from a competitive strategy standpoint, the banking on maintaining the same level of cash flow over the next 30 years is intensely problematic, and I wouldn't bet on that. That being said, I wouldn't encourage people to go off half-cocked and just start buying practices. And I think that segment of the market, the clinician who owns a practice that wants to become an entrepreneur who owns a business, ask themselves, okay, what's next? How do I go about acquiring practices? Do I want to do this? Am I fit to lead them from an executive standpoint? So prior to the last decade, for me, I spent 15 years running 3 different businesses for Patterson Dental Supply. And I learned a lot about enterprise publicly traded companies at a leadership level. So if you take, we're talking about 3 decades of dentistry here. If you take my prior 3 decades and you break them all down, it's corporate America experience, it's consulting experience, it's being an entrepreneur myself, and being able to bring a lot of those resources to bear at an ownership level. So the people I work with are founders of typically solo practices or maybe 2 locations. They're contemplating what's next, how to appropriately acquire practices or build them in a de novo. What about bringing in partners? Am I ready for that? should I bring in a partner? Is it an equal partner or a minority partner? Like, and then we think about the structures of the businesses. Should I build a DSO? Do I even know what a DSO is? Do I need a management company? Like, how does the business really fit together? People who went to dental school learned a tremendous amount about clinical care, and arguably today's clinicians have never been better. The clinical health of the profession is at an exemplary level right now. But when you start transitioning into owning multiple locations, your clinical capabilities fall by the wayside quickly. It's about leadership. It's about having the ability to make decisions in an interconnected way, because the decision you make today has downstream repercussions, and we want to think about that from a second level and third level decision making process. And so these are a lot of the things we go through in next level executive with the members who are in it. And I teach a session every week that has a business topic to it, a principle, a concept, a foundation. And then we spend about 60 to 90 minutes Friday afternoon roundhousing that. So the members of the program, there's a lot of bi-directional give and take Q&A. And it's a great group of people. It's also a lot of fun. And it's really the business acumen that arguably is lacking in dental school, and arguably also you wouldn't want to create a business through trial and error. So this is a way to accelerate being a more effective executive, I would say.
So if someone is at the point right now where their dental practice is starting to see some success, but they're realizing the complexities that are before them, that's the person that's reaching out to you and saying, hey, do I go left? Do I go right? Do I go up the middle? And the answer is probably different depending on the person, their tolerance for pain, and their risk profile, right?
Yeah, and also their longevity ahead of them. You know, I mean, if you come to me and you're, I don't know, 62 years old and you're a couple of years from retirement, I'd be hard pressed to say that, taking on debt to add locations is in your best interest. I don't think it probably would be. But if you're mid-career and you've got, I don't know, 10 to 15 to 20 years of work ahead of you, then you got to be thinking, going back to our competitive strategy comments earlier, you don't have to build the next Heartland Dental to be successful. But I think owning a solo practice from a defensive strategy standpoint is a narrowing proposition. The likelihood is that you might want to build a 3 or 4 location group practice with a couple of minority partners, dentists, associates at a clinic level that help you diffuse some of the responsibility off of your shoulders, that creates a cash flow business. You may not want to sell this thing for a long, long time, if ever. And it may be a lifestyle business that complements the lifestyle you want to lead. And I think to be rational about what that looks like and how it evolves, and to do it intentionally without, again, going off and personally guaranteeing a tremendous amount of debt and then making a bunch of bad acquisitions. I think to be prudent and just say, hey, I'm going to spend a little bit of time. I'm going to take a year to become a better executive. I'm going to figure out how this thing all fits together. And then I'm going to make calculated decisions on how my next 5 to 10 years unfolds the way I want them to. And I'm also going to do it with the understanding that the more risk that I take is going to have arguably a drag on my family relationships, because it's going to create a lot of stress on me. So I want to be eyes wide open about how the business I choose to build complements my family and the lifestyle I want to lead.
Love it. And you're one of the best at it. How can people get in touch with you if they want to learn more about what you're building and how you help folks?
Yeah, thanks for that. A lot of different ways. I've got a podcast that you can find on all the platforms. It's called The Next Level Executive. Love it for people to subscribe to that. The website is www.thenextlevelexecutive.com. And my email address is Perrin, Perrin, at thenextlevelexecutive.com. It's a really long URL, but it was, oddly enough, it was not taken when I looked for it. So
that's what's most important these days. That's another difference between now and 1995, right? Now you look for business names based on if the URL is available or not.
Gary, I mean, one last maybe thing or thought. you and I both work in the group practice space a good bit, and we hear a lot of people prognosticating about, private equity is going to own the world. Dentistry's in terrible shape. We're all going to work for a private equity backed group. We're going to be at 80% consolidation in another 5 years. Stop it. All right. Can we just stop for a second? Can we push pause and pump the brakes? Because family physicians are about 75% consolidated, according to the AMA. And that's been happening a lot longer than dentistry has. Yeah. So for your audience that feels like the sword of Damocles is above all of our collective heads, and this is going to end badly, you know, I don't agree with that.
It might, yeah. It's so I think it's in our hands, right? Like it depends on how we decide to. Are we going to level up and compete? And when I say that, I don't mean just by the numbers. I mean how we treat the patients and how we like. If DSOs are truly as bad as everybody, I'm playing into what you're saying. If it's truly as bad as what people are saying, and they're treating people as poorly as everybody says, the employees and the patients, then that's an opportunity.
Yeah, it absolutely is. I mean, I don't think DSOs are all bad. I think like everything else, they're, a handful of poor companies in every sector of the economy, dentistry or otherwise. But I think, for those who are of the mentality to just throw in the towel, it's a fait accompli, I can't compete, I can't win. I take a completely different tact on that. And my attitude is one of bring it on. I love being a big fish in a small pond. I love having competitive advantage to be able to compete with all that. Heck, if there are a lot of them in your neighborhood, use them as a recruiting vehicle. Change your mindset. There's a wealth of opportunity out there ahead of us. And arguably, people are living longer. They value their oral health more than they ever have. And dentistry has so many advantages that are tailwinds blowing in the right direction. So let's pump the brakes before we all throw in the towel. Let's think about where we are in our career. Let's think about what the next step is. And arguably, if you want to be a more competitive practice or a small group, you got to be a better executive to lead it, not just a better clinician to cut crown preps.
Love it. Well, great job. Thanks. This is a great episode. I already know what's going to happen. They're going to end up cutting that little end part and putting that at the beginning because I was really passionate and I think money right on the money. So thank you so much for coming on and sharing your expertise. And if you don't know Perrin already, reach out to him, talk to him. I promise you, whether you work with him or not, you're going to learn something and he's going to help you pick a direction. So thanks so much for coming on, my friend.
My pleasure to be with you, Gary. Thank you. Appreciate the time.